The National University Hospital, or NUH, has seen better outcomes for heart failure patients over a decade-long period. Data released today shows that patients readmitted within 30 and 180 days were reduced by close to half between 2009 and 2019. And despite increasingly complex heart failure conditions and complications, inpatient death rates were kept at below 2.5%. That was over the same period. Well, doctors say improvements can be a result of advances in implantable devices and medicine, as well as the availability of enhanced care support. For more, we're joined now by Dr. Raymond Wong. He's senior consultant at the National University Heart Centre's Department of Cardiology. Good evening, Dr. Wong. Thank you for joining us.
Good evening.
Good evening. Help us to understand, Dr. Wong, why do patients suffering from heart failure get readmitted so frequently?
Well, first and foremost, the general age of heart failure patients are elderly. They are in late 60s. And so there are associated problems related to frailty and geriatric related issues. But really, the cause of admissions are both heart-related as well as non-heart related. So in other words, because of the age, they can be admitted for example, chest infection. But specific to heart-related conditions, we know that heart failure is a progressive condition. Locally, 1/5 of the patient may not survive the first year. And we know that half may not survive 5 years. And a typical heart failure patient have many other associated conditions. High blood pressure, 65%, coronary artery disease, 60%, kidney disease, 40%, and of course, diabetes, 55%. So any of these conditions, if not managed properly, can trigger heart failure. So those are the main reasons.
And can you elaborate? And can you help us understand or elaborate on the reasons why hospitals are seeing improved readmission rates?
Well, I think that comes with a lot of effort, and primarily we redesign our care of heart failure patients around heart failure patients, as well as the caregiver. We provide them with maximum support. So one can therefore understand that we need to get a multidisciplinary approach. A team consisting of allied health, the doctors, nurses, as well as a psychologist, all to come in, as well as the social facilities and social welfare services. And right from the get-go, when the patients get admitted, we will, our heart failure coordinators will provide education and counseling to the patients and caregiver to teach them aggressive lifestyle modifications, salt and fluid restrictions, and many of those stuff. And when they're discharged, again, we organize our care around them. So early discharge clinic, laboratory tests, drug titration, the use of phone calls by the care coordinators to just make sure the patients remain well, and the use of remote monitoring. And we cannot underscore the importance of advancement in medications. Since 2016, we have newer medications, sacubitril and valsartan is one of them. The other one, of course, is the sodium glucose co-transporter 2 inhibitors, which is SGLT2. And as mentioned earlier, being able to implant devices in suitable patients, I think all those contribute to reduce readmission rates.
Dr. Wong, we understand that in the last 3 years, more than half of heart failure patients at the NUH Heart Centre, they also suffer from diabetes. You mentioned that earlier, that it is also another underlying sort of factor that some of these patients have. But is there any connection there at all?
Oh, absolutely. We actually published a paper in a British Medical Journal in 2018, looking at more than 30,000 local patients who were admitted to local hospitals between the year 2003 and 2016, where we showed that if a patient has heart failure and diabetes, his chance of dying actually is at least 20% higher than, say, someone who has hypertension of comparable sex and age. So, and locally in NUH as well, we've shown that the 30-day and 180 days readmission rates are significantly higher if heart failure patients have diabetes compared to without diabetes. So having a diabetes is a big deal in heart failure patients.
And what's then the biggest challenge when trying to tackle patients that have both these conditions?
Oh, thanks, Steve. Well, that's a good question. So it is a big challenge because As I mentioned earlier, there are many associated conditions that a patient with heart failure can suffer at the same time. For example, diabetes. So we are just as committed to treat the diabetes by providing a holistic care to diabetes. So achieving a good sugar level for the patient, prevent and manage the complications related to diabetes, like the kidney disease, the eye disease, and stroke. But at the same time, we need to manage the heart failure-related conditions. So the use of many drugs, at least 8 drugs and above, for example, education, counseling, and prevention, as well as management of complications related to heart failure, stroke, heart attacks, as well as kidney diseases. So all these things are not, they don't just pose big challenges to the healthcare team, actually, but they also pose a lot of challenge to the patient. You can imagine the burden of the pill, financial burden, as well as the emotional stress in having to restrict salt and fluid and do the right thing day in and day out of their life.
It is a lifelong effort. Dr. Wong, thank you very much for that. We were speaking there to Dr. Raymond Wong from the National University Heart Centre.